So this video is about the adrenaline response, which is in topic 7 and one of the more difficult or slightly more got lots of detail to it that you need to know. So the way we're going to teach you is with a story. So imagine you and your significant other. Over here we have someone who looks a lot like Mr. Kerr, the drama teacher. Okay, walking on a lovely walk in the seaside or in the woods, and all of a sudden you come across a bear, a scary bear, not scary enough. There we go, nice scary bear. Okay, you are going to be scared. You're going to want to prepare yourself to run, to fight, most likely run in this situation. And your body has a very good way of basically getting your whole body to kickstart its preparations for exercise, and that is the adrenaline response. So, as with any sort of negative feedback loop or any sort of homeostatic mechanism, it starts with a stimulus. With the adrenaline response, the stimulus is ever so slightly different. It's multifaceted, because basically lots of things can be scary or perceived as dangerous or dangerous stimuli. It could be the noises of the gargling bear, the pain as it bites you and tries to eat you, the touch as its nose sort of sniffs around you, its stinking smell or the smell of blood on its breath, and just the sight of a bear would scare you as well. So all of these are the stimuli for your adrenaline response, and your detectors, the things that actually sort of pick up these dangerous stimuli, are again multifaceted. It could be your eye, it could be your nose, it could be your skin, it could be your ears, and it could be the pain receptors in your skin, which are actually just nerves that sit in your skin. So these are your detectors, and after the detectors we obviously need our processor. And as you can see, all these nerves are synapsing, to use a word that you'll have remembered from 4th form hopefully, onto the medulla oblongata, again another 4th form term. So this is a very, very low down part of your brain, which means it's sort of very primeval, very evolved very early. And what the medulla will do is it itself will process that information, but then send out nerves down your spinal cord, which will exit your spinal cord. So this is your spinal cord. So this is your spinal cord, and the nerves will exit and they will synapse again onto these little glands that are near your kidneys. And the sort of Latin word for kidney is renal, and like near or about is ad. So these are your adrenal glands. And what this does is these nerves, when they sort of fire onto the adrenal glands, they release the very, very aptly named adrenaline into the blood. So that's where adrenaline gets its name. Adrenaline is a hormone. Okay, so it's one of the many hormones you need to know. And that adrenaline is now in your blood, and because your blood is your blood, it circulates all over your body, and you now have this messenger, this chemical messenger, that will travel all over your body and start preparing you for exercise. Remember, that's the aim of the game, to get ready for exercise. And it does a few things, and lots of things. As I said, it travels all around your body. First, it will go to your heart, where it will increase your heart rate. So you have a higher amount of blood being pumped per second, and therefore more blood being delivered to muscles and to your liver, which we'll hear about in a second. The second is an increased force of contraction. So each pump is stronger, so more blood will be pumped per pump. Okay, so that will also raise your blood pressure. So you can also say raise blood pressure. That's a reasonable thing to say. You'll increase your breathing rate, because you're going to need oxygen for all this respiration that we're going to hear about later. So more oxygen in your blood, the greater you can do aerobic respiration. And this is the one that's slightly confusing, that we'll talk about more when we talk about blood glucose regulation. But you'll also break down this molecule known as glycogen. And glycogen is sort of animals' answer to starch. There's multiple glucose sort of strapped together, and it tends to exist in your liver. It does also exist in your muscles. And what ends up happening there is adrenaline will go to your liver. It'll sort of act on your liver, so it'll sort of bounce out here and tell your liver to start breaking down this glycogen, which is a store of glucose, into its constituent glucose molecules. So each of these hexagons meant to sort of show you there's a glucose. That glucose can then jump into your blood and go off to your muscles. So you've got glucose and oxygen, which we spoke about with the lungs, flying around in your bloodstream more than usual. The final thing it does is another new word known as vasodilation. And what vasodilation does is it basically widens your blood vessels, or your arterioles, if we are being very, very specific. So these are small arteries, and especially the ones that go to your muscles. Okay, so these are two new words, but basically all you're doing is widening the blood vessels, these little arteries known as arterioles that go to your muscles. That way you get more blood flowing to your muscles. The more blood that's flowing to your muscles, the more oxygen that is going to your muscles, the more glucose that is going to your muscles. And therefore, as we said earlier, you've got everything you need for respiration. So you've now got your muscles with lots of blood going to them, lots of glucose in your blood, lots of oxygen in your blood, so that you can do lots of aerobic respiration. This is aerobic respiration, and release lots of energy, and therefore you can run or fight this bear. Yes, I did manage to find a picture of a pillow fight with a bear.